Hi everyone, so welcome to my 15-week pregnancy update. I'm filming this in my mum's kind of loft room. It used to be my old bedroom, but it's like used as a place for storage now, and it's got all Caitlin's kind of old newborn stuff that obviously we're keeping. So that's why I'm in a different setting than I have been for my previous videos. So this is going to be my 15-week update, as I said, and I'm going to be talking about a few appointments that I had this week. It's actually when I turned 16 weeks I had 2 appointments, so but I'm going to put it in my 15-week update because I'm going to talk about kind of the symptoms I've been having, and it kind of go through what's been happening in this week rather than film a 16-week one, because obviously by next week I'll be 17 weeks. And I want to talk about my gender reveal, or my gender scan that I've got booked tomorrow in my 16-week pregnancy update, because I will be 16 weeks when that's filmed, if that makes any sense whatsoever. So I think first of all I'll talk about symptoms for week 15. They haven't been that much different to how they were before. I'm still getting really tired. Tiredness is probably the main symptom in this pregnancy that I've been struggling with, and that goes from looking after an 8-month-old baby, which is hard because obviously my pregnancies are quite close together, so it's going to be hard however old your child is, even if you've got a 3-year-old, 4-year-old. If you've had one child already and then you're pregnant again, it's always going to be harder the second time being pregnant, because the first time obviously I was able to lie down a lot, put my feet up. Now I'm kind of constantly running around, even though I do have help from family looking after Caitlin, which makes it easier, and this pregnancy is a lot easier, touch wood, than Caitlin's pregnancy. I mean, it hasn't been really bad to the fact that I'm falling asleep throughout the day. I just feel like I lack in energy. I'm a bit out of breath. I think it's because I'm always up and down the stairs to the toilet a lot, 'cause I've had like the need to pee frequently, which is normal. So I've been more tired also because Caitlin wakes up at 6 AM every day, and she's not been going back to sleep lately. She's kind of going through a phase, 8-month-old phase, where she's quite clingy, and it's really wearing. But apart from that, I mean, it makes more sense that I've been getting tiredness due to the fact that I've been getting up early rather than it being completely the pregnancy. It is mainly to do with having a younger child to look after as well. But that's kind of still been my main symptom, something that I'm still experiencing the most. Sickness, I don't really have any sickness anymore. I don't really get much nausea even when I'm hungry. The nausea seems to have passed. I'm 16 weeks at the moment. I'm 16 weeks and 2 days, 3 days, something like that. And yeah, I just don't really get sick anymore. I've never been sick in this pregnancy, only like a tiny bit at the beginning, but I've never been sick at all. Like proper forceful, you know, how it can be, how it was with my daughter anyway. Obviously the sickness is not going to be like, unless you have severe sickness, it kind of does go away when you hit the 2nd trimester. So I've not really had a problem with that. I've not really been getting bad ligament pains. Like with Caitlin, I had really bad ligament pains, and she was lying transverse, so she was like sideways, and it just gave me the really bad cramps to the point I had to go A&E, and they had to scan me to diagnose that, yeah, that was what I was feeling, the pain I was feeling. And they had to give me like strong painkillers that I could take in pregnancy, because and I was about 17 weeks, so not far from how I am now. I also had a lot of pressure with Caitlin, and this time around I don't have as much pressure, so I am definitely carrying higher in my 2nd pregnancy, which is really surprising, because I always thought, and I've always read, that your 2nd pregnancies you carry lower because the muscles aren't as strong as your 1st pregnancy. But with my 1st, I found I carried very low, and I was in pain for weeks and probably months on end until I hit the 3rd trimester, and then the pain kind of went because my uterus had obviously lifted up, and it wasn't pushing down heavily. I was in a wheelchair like for about a few days when I was on holiday when I was pregnant with Caitlin. I was about 24 weeks, and I could not walk because the pressure was so bad. But this time, touch wood, I am carrying higher, and it's a lot more manageable, especially when I'm still carrying an 8-month-old baby around and standing up a lot, and I'm not able to sit as much as I did with Caitlin, so I'm really lucky. I have had a couple of low blood sugar, I think it's low blood sugar episodes. The first one, I think I went too long between lunch and dinner and I didn't eat a snack, which I should have done. I have trouble eating little and often. I've always kind of eaten 3 meals a day quite far apart, so I went too long without eating, and it was coming up to dinner and I just felt really shaky, really hungry, and I think it was because I had obviously gone too long without food. And the second time it happened, I was actually at the hospital for my consultant appointment, which was the Thursday just gone. The 4th of May I had that appointment, and I think it was anxiety for being in hospital, because I get really anxious whenever I go to hospital, even if it's not to expect anything bad, or even if it's just a regular appointment. I just get really nervous. I think that's quite common. But yeah, I just started to feel really weak, and I had some polos in my pockets, and I hadn't actually eaten enough for breakfast. So again, it's because I didn't eat enough. I really need to work on that, because it's not good to be out and about and, you know, feel like you're going to pass out. So those are like the main symptoms I've been experiencing. Nothing much different from what, my 14-week update, but I will talk about my 2 appointments that I had when I hit 16 weeks. The first one was my midwife appointment. Originally I was seen at a different clinic with a different midwife, but I requested to see a different midwife because I didn't feel like I was getting... She was nice, the lady, but I didn't feel like she was the midwife for me, if that makes sense. I kind of wasn't really 100% happy. She didn't really give me like the information that I needed. I don't know, every midwife's different, and sometimes if you don't get on with the one you've got, then you can always change, and I didn't think I'd be able to change, but I did. So anyway, I now referred to one that's actually 10 minutes walk from my house, so it's a lot closer than the other one anyway. And it's a lot more convenient to leave my daughter with my mum while I go, and I don't have to go often, so it's not like a big deal. So basically, that appointment wasn't very long. It was only like 10 minutes long, and all she did was just talk about like how far along I am, like how I'm feeling mainly. She did my blood pressure, which was, I've actually got my notes right here, and it was 90/60, which is again low because I've been getting really lightheaded, which is another symptom, but that's kind of normal for me anyway. It's not just a pregnancy symptom. The fetal heart rate was 155 beats per minute, which she said were normal, like between 120, I think 110 she said, to 140, no 160, sorry, or something like that. She said are in the normal ranges, and mine was, well, the baby's was 155, which is good. Caitlin's I think was averaging 160, so I don't know if that means I'm going to have a boy or not, but so not really much else happened in that appointment. I had a urine check, which was normal. My blood sugar is normal. I also had my first trimester prenatal screening report back, which is my Down syndrome blood test, like testing for Down syndrome and a few other things, and it came back low risk, which is really reassuring. I never really worried about that anyway, but you still do worry about it when you have these things tested for. But yeah, apparently I'm low risk, so I got that back. My bloods are fine. I haven't got anemia, which is surprising because I kind of thought I did. And I did with Caitlin, but maybe that will come later on. But I don't have any. And was my consultant appointment, which was Thursday. Yeah, I said it was Thursday the 4th, and then my midwife appointment was Wednesday the 3rd. So the consultant appointment was pretty straightforward. I just saw a consultant because of my previous history with anorexia, anxiety disorder and migraines and epilepsy, which is a whole other story, but I don't have issues with those anymore, touch wood. I'm touching wood a lot because I just feel really lucky in this pregnancy. But yeah, I just spoke to a consultant. I had my blood pressure and urine checked and they were both normal. My blood pressure was a bit higher, but I think hospitals make me nervous and they make my blood pressure a bit higher. It's kind of a normal hospital thing, I'm guessing. So anyway, I spoke to him. He asked me a few questions about how I'm feeling, and I have been feeling increased anxiety. So he offered to send me to like an anxiety specialist just to help me through some of the thoughts I've been having and worries I've been having, just to reassure me. So I said, yeah, I think I will take that up because I do have an anxiety disorder and it does help to kind of to talk to someone, even if it's just one appointment. So I've been referred to see a lady next Wednesday, and I'll be 17 weeks exactly that day. So hopefully that will help me. I've also been booked in for another scan. I'm not entirely sure why I've got to have another scan. I mean, this scan's going to be like 23-week a scan. And he said it's to check blood flow. I've never had a problem with that in the past, but I don't mind having more scans. I find it reassuring having as many scans as possible. With Caitlin I had about 1 million, so I'm not really worried about that. My next scan is obviously my gender scan, which is tomorrow. I'm really looking forward to that, and I want to add in what the gender is in my next pregnancy update. So I'm really excited to kind of know what we're going to be having. And then my scan after that is in 3 weeks time, which will be my 20-week anatomy scan, and then the 23-week whatever scan that's going to be. I don't really know what to call it. It's just to check the blood flow, so maybe growth scan, or just a checkup. But I think I'm going to be on holiday that week, so I might have to change the appointment to the week after. So I'll be 24 weeks. So I will show you my bump shot now. I don't really know if I've grown from last week. I can't really tell, to be honest. Sometimes I seem to have got bigger, sometimes I seem to have got smaller. I think it depends on what I've eaten and if it's the end of the day, or what time, depending on what time I film, determines how big my bump is. I think the baby is like the size of a pickle or something. I can't really remember. I'm rubbish at like knowing how big the baby is or what size. I'm kind of, I was into that with my daughter, but this time I'm kind of like, okay, yeah, I'll just take what the people that scan me say rather than reading it on however big the baby is, if that makes sense. Because I have so much to do and I don't really look at in detail at everything that I looked at with Caitlin when I was pregnant with Caitlin, because I just don't have the time anymore. So I'm sorry for the setup, it's a bit rubbish because I'm in a bit of a weird space. I don't really have any space to film, to be honest, but anyway, so I'm sorry for this amateur related video type thing. But yeah, this is my 16-week, well 15-week bump, but my 16-week bump because I am 16 weeks. But yeah, I mean, man, it does look quite huge for 16 weeks. The front and the other side. I can hold it in a bit, so I think it is partly bloated from drinking half a litre of water this morning. But I will update you in my next video with my 17-week update, my 16-week update, sorry, and I would add in my gender reveal. I'm not going to do anything special really, I'm just going to kind of add it in as a normal kind of update. So please subscribe if you're interested in finding out more about my pregnancy, and I'll see you in my next video. Bye.